Now, 750,000 premature babies die unnecessarily every year. The first ever global report into babies born before the 37th week of a 40-week pregnancy has found the simplest possible ways of saving their lives. As simple as carrying the baby in a sling against the mother's body or giving them knitted hats to keep them warm. Our health and social care correspondent Victoria Macdonald reports.
Logan Caroline Hines was born at 28 weeks. He was desperately ill with infections and chronic lung disease.
He was in special care for 8.5 weeks, and it was a very scary time indeed. The doctors just said premature babies can just be one of those things. There wasn't any active research into me as to why it happened, why he was 12 weeks early. And I sort of went along with them thinking, yeah, it's just a one-off and it won't happen again.
But it did happen again. Her next two babies were both born too early to survive. It took a specialist at St Thomas's Hospital in London to diagnose and treat an incompetent cervix. And now she has Cicely, born at full term 18 months ago. The fact is, though, premature births are on the increase. And for the first time, an international study shows just how large the numbers are. Taking figures from 184 countries, it also highlights the massively wide disparities in survival. The UN-backed report from more than 100 experts reveals that 15 million babies are born too soon every year, that 1.1 million die, that's more than from HIV and malaria, and that in poorer countries, 90% of babies born before 28 weeks die within the first few days. In richer countries, it's fewer than 10%.
1.1 million children who die every year are dying because they were born preterm. And we shouldn't think that that means there's nothing that can be done about that. That's one of the main messages out of this report, that the survival gap around the world for babies who are born preterm doesn't have to be the way that it is. There are things that we can do.
Indeed, the message is people should start from where they are, in a bush hospital in Africa or an intensive care unit here in London. For a long time, experts have believed there's not much you can do to save an extremely premature baby's life unless you have high-tech, complex equipment like this. But today's report completely busts that myth, because it shows that using something as simple as this, a knitted woolen hat to keep the baby's head warm, can also work. In this maternity ward in Malawi, along with the hats, they encourage kangaroo care, the baby held against the mother's skin. Add to this antibiotics and a $1 steroid injection to develop the baby's lungs. Simple and cheap, and the authors say it could save 3/4 of the babies who die every year. But the number of premature births are rising almost everywhere. The US is 6th highest, with more than 500,000 a year. In the UK, it was 60,000 in 2010. At the baby charity Tommy's, they've been funding research into why.
It's true that our population is getting older who are having women. They're probably getting more obese. And these factors do increase the risk of some of the reasons we give birth early. So mothers get sick, they get raised blood pressure, their babies don't grow as well, and they all increase the chance of babies being born early. However, even mothers who go into labour early, which are unrelated to that, is also increasing, and we do struggle to work out why that is the case.
This is, the report authors say, an overlooked and neglected problem with too little emphasis on prevention. Preventing babies being born too early and preventing those babies from dying.